Much members of the brief, you are most welcome for this press briefing. Today, West Nile Parliamentary Caucus had a meeting with the Association of Surgeons of Uganda in regards to a surgical camp which is being planned in West Nile region next month. In this press briefing, we want to update the citizens, especially those in West Nile, on the program which is going to be implemented in September. So with me, I have the chairperson, West Nile Parliamentary Caucus, and members of Parliament from West Nile. I have the President of Association of Surgeons Uganda with his executive in this press briefing. Without wasting time, I want to invite the chairperson of West Nile Parliamentary Caucus to address you. Thank you.
Yeah, thank you, Dr. Musa. I am Dr. Boka Didi George, Member of Parliament of Bongi constituency and the Vice Chairperson of West Nile Parliamentary Caucus. This morning, we had a meeting with the leadership and members of the Association of Surgeons of Uganda. The purpose of the meeting is for the President and his executive to brief the leaders and members of the West Nile Parliamentary Caucus on a surgical camp, regional surgical camp that is being planned to take place in West Nile next month from the 20th to the 28th of September. Indeed, we did receive the brief from the President, and the President did make a request to us, the members of the West Nile Parliamentary Caucus, and to the whole of government and society to support this noble cause. The key points from our conversation is the population that will benefit from this surgical camp. West Nile as a sub-region has close to 4 million people. And about 1 million of these are refugees, mainly from South Sudan and neighboring countries, including migrants from South Sudan, Central African Republic, as well as the Democratic Republic of Congo. The population is generally grappling with a double, if not triple, burden of diseases, infectious diseases, diseases of lifestyle, as well as outbreaks that have been occurring and affecting the people. We therefore do appreciate the gesture of the Association of Surgeons of Uganda to take specialist services to the 13 administrative units and local authorities of West Nile. This surgical camp will be hosted by a number of health facilities that the President of the association will be able to provide us more details on, and for the camp to be able to succeed, it requires resources. And these resources have to be mobilized by us, starting with the members of Parliament, the leadership and stakeholders in West Nile, and friends of West Nile, including ministries, departments, and agencies. What are these resources required for? Specifically, the resources will help us be able to transport the surgeons to the facilities that have already been accredited to provide services to the citizens in the Arua city and the 12 district local governments. The team of health professionals will also require accommodation in terms of hotel rooms for about 580 specialists, healthcare workers that will be in the region. We need to mobilize resources to see to it that they have accommodation. The surgeons also appealed to us to feed them, providing food and water for them during the surgical camp, and most importantly, the need for us to mobilize our citizens to be able to benefit from these specialist services that are mainly being in the national referral hospitals, in the regional hospitals, that will be taken closer to them. We therefore appeal to all men and women and citizens of goodwill, government ministries, departments, agencies, and local governments under the stewardship of the Ministry of Health, the national medical stores to help us with essential commodities and health supplies. We also appeal to development partners as well as implementing partners and the humanitarian community, OPM, UNHCR, and the partners in the health sector to join hands with the Association of Surgeons of Uganda to see to it that this event is a resounding success. Apart from the civil society, we also appeal to the business community, the private sector, the transporters, the hoteliers, the media operators to come on board and join the association to see to it the services are provided to our citizens. Last but not least, we appeal to our citizens. This is an opportunity that comes once in 15 years for specialists from LAGO, the national referral hospitals, to come and bring services closer to us. We need to reach out, mobilize our communities to see to it that they come and receive these services near their doorpost. I want to thank the members of the West Nile Parliamentary Caucus for being part of this pressure, and also want to thank the President of the Surgeons of Uganda for the initiative of mobilizing your members to give back to society through having these surgical camps. You did one in Lira, and the people of Lango benefited from it. You did one in Ankole sub-region, and the people of Ankole and Western region benefited from it. And you are welcome to West Nile for the people of West Nile to benefit from these services. Thank you.
It's a pleasure to be here. And as the Association of Surgeons of Uganda, and I am Moses Galukande, Professor of Surgery and the President for the association at the moment. As an association, we care about surgical access to safe surgical care. The access to surgical care is limited in this country for many reasons, and we care about vulnerable populations, and this is the reason we go to West Nile. Like the chair, as the caucus has mentioned, this is something we do on an annual basis. We choose a region in the country, and we go there, we pitch camp for a week, and we do surgeries for free. We don't charge the patients any money, though we need to mobilize resources to enable us to do that. We anticipate in the region that we're going to be at 23 sites. We've already identified them, accredited them, and they're getting ready for this exercise. We'll be at 23 sites. We're planning to do over 100 surgeries at each one of these sites, and for all manner of surgical problems. We have more than 12 specialties that are going to participate in this exercise, from doing brain surgery to doing bone surgery, we call orthopedics, operating on small children, women, the blind with what we call cataracts. In Uganda they call it insenke. We've lined about 600 of those, and this is going to be for free for this population. We believe that we will see about 10,000 patients. We'll screen them and select those that would be suitable for care, surgery in this week. We think the figure might exceed 2,500. We think this is the biggest number of surgeries that can be done or has ever been done on the continent in 1 week in an arrangement of a surgical camp. When we are done with these operations, we do plan and we actually do follow up these patients for 30 days. So our team remains behind to make sure that these patients are followed up. When you do surgery, follow-up is critical, at least for the first 30 days. We call them complication rates, is about 2%, so we should be able to cater for those people even after the initial intensive 1 week is done. Again, it's free surgery to all the people that require it in all the 13 districts in the region. So we appeal again to well-wishers to join hands with us to mobilize the resources that we require, like the chair has indicated, the transportation of the workers, accommodating them. We need over 580 rooms for 7 days or for 7 nights. And we're excited, we're looking forward to serve the people of West Nile this time around. Thank you very much.
The cost.
Yes, on average, these 2,500 operations that we'll do, on average, it will cost us about 480,000 each operation. But also to emphasize that the workers, the surgeons, the nurses, the imaging people, the lab, the pathologists don't charge a shilling. So the figure we're talking about is money that is used to facilitate the process, the supplies, and transporting people and feeding them. So when you average it out, it becomes 480,000 per patient. So you are encouraged to think about it that way, and if you want to sponsor, even if it's one operation, that can change a life for life. Thank you.
Thank you very much. My name is Dr. Charles Sayube. I am the Member of Parliament for Koboko Municipality. I would like to join my colleagues in thanking the Association of Surgeons in Uganda for this very good gesture. It's more of a pro bono initiative, what you see in the legal profession, but now this is the medical profession where we have the best of the best surgeons in Uganda descending on West Nile, and as the President said, the next time it will happen is after 15 years. So I would really like to urge the people of West Nile, the district health officers, to ensure that we have been able to select quite a substantial number of patients to come in the areas of orthopedics, ENT, ophthalmology, cardiothoracic, and we are now bringing the best surgeons to the region. Usually it's people from West Nile leaving West Nile coming to Kampala to seek for these services. So that 480,000 that the President is talking about is a paltry fee. If you look at under ordinary circumstances, somebody having to jump onto a bus coming to Mulago for some of these surgeries, the waiting time, the duration they spend in Kampala, this is really a very small figure, and I'm very glad that we shall accomplish this objective. And I would like to urge government that in the near future we could put this as a recurrent expenditure in our budget, so that every year, whichever sub-region it goes to, the association does not have to go and start doing fundraising. This becomes a recurrent cost, and we are sure that we're able to reduce the case backlog, because when you move around West Nile, you'll see that there are many cases of people with cataract, people with fractures, and so forth. So I'm very sure it's going to be a very successful camp. Thank you very much.
Thank you very much. First of all, I'm Gabriel, Member of Parliament for County in Zombo District. And I would also like to thank the Association of the Medical Surgeons of Uganda for having given West Nile the opportunity to have the medical camps from the 20th of September. In the Greater Alur sub-region, the camps will be in Nebi Hospital, in Goli, and in Nyapea hospitals. What I know is that the team in this area will be overwhelmed because the people in this sub-region really do not have this opportunity. I would like to call all the stakeholders in Greater Alur sub-region that let us embrace the opportunity, let us make the small contributions we are making to enable these camps to be very successful. I would like to inform the DHOs of the region to take charge, and the other key stakeholders, that the team which is coming to our area should actually have a very successful camp in this region. And on our part, we are going to do our level best to make sure that the camp is a success. Thank you.
Association for coming to West Nile, and I want to appeal to the people of West Nile to utilize this opportunity that has been there for about 15 years, and now we are going to host it, to utilize it in order that they should be able to access these services. They are going to operate in different disciplines. The disciplines will incorporate working, doing surgeons in various areas, and they should have to utilize it. And I want to appeal to the stakeholders to work as a team in order to host them, in order to provide all what is necessary in order to see that this program is a success in West Nile. Thank you.
Thank you so much to the people of West Nile. We are very excited to be coming to the region. We will be in the 12 districts and Arua City. So we'll be in Pakwach, we'll be in Zombo, we'll be in Nebi, we'll be in Koboko, we'll be in Madiokolo, Terego, we'll be in Ubongi, we'll be in Ajumani, we'll be in Moyo, we'll be in Yumbe, and Maracha. So we really look forward to coming and bringing these specialized services to you. But in addition to the curative surgical services we offer, we also have a component of school health screening. We will go to 12 schools in this region, both primary and secondary schools. We'll be screening for musculoskeletal deformities. We'll be screening for dental problems, hearing problems, eye problems, so the teams will be in the schools. And also breast cancer and cervical cancer and prostate cancer screening will also happen. So you will find that so many kids are having issues with performance in class, but basically because they can't hear or they can't see, or unneeded glasses probably, and this would really change a lot. So we really call upon all of you to support this great initiative. As our legislators have mentioned, it will take us about 15 years to go back to this region. So we want to make maximum impact in the region. Thank you.
Remember, all the workers are volunteers. We don't pay them. This is for the rest of the resources we need.
Where do we expect the 1.5 billion to come from? This is not the first time that such a surgical camp is being organized in this country. Last year, a similar camp was organized in Lango sub-region by the same surgeons. Earlier this year, there was a similar camp organized in Ankole. And so the people that will support the surgeons in achieving the mobilization of the resources required to successfully host the camp are: one, the Parliament of Uganda, through its social corporate responsibility budget, is being able to support the surgeons in Lango sub-region, in Ankole sub-region, and so we expect the Parliament to be able to support this initiative. To the Ministry of Health, this is a duty of the Ministry of Health. Ideally, it should not be the surgeons doing this. So we expect the Ministry of Health, the clinical department or directorate of the Ministry of Health, to work closely with the surgeons to support the efforts of the Association of Surgeons of Uganda. We have government facilities that are going to host this event. So the space is going to be used, clinics, theaters, the equipment going to be used predominantly in the public health facilities, the staff that are going to work with the surgeons are going to come from the regional hospitals, some of them from the district hospitals, others from the health center floors. We also expect the national medical stores, NMS, to be able to mobilize and leverage essential medicines and health commodities to supplement what is available on the ground in these health facilities, in order not to mop up the medicines that are being used for routine provision of health care in these health facilities. West Nile is a host to a number of refugees, close to 1 million. And the refugees are going to benefit from these services, so we also expect the Office of the Prime Minister, UNHCR, and the humanitarian agencies, especially the health implementing partners, to be able to support in kind and in cash and materially to contribute towards the 1.5 billion. Beyond that, we have the civil society organizations in West Nile and in the country. We have the private sector organizations, the chambers of commerce, industries and business associations. We have the pharmacists that are providing pharmaceutical services in the private sector. We have the media fraternity that will be required to provide publicity. So we call upon the UBCs, the NTVs, the NBSs, and the New Vision, and the Monitor newspapers, and the other media houses to, as part of their corporate social responsibility, provide support to publicize this event. And within the districts, the district local governments are going to be part of this. We expect a follow-up meeting in Arua City for the West Nile Development Association, for the 13 local authorities to see how to work together with the district health offices, the district health teams, and the facilities in charges and staff for local contribution to support this initiative. But we also appeal to each and every citizen of goodwill. If your heart is touched by the need to save lives, the amount needed is not so much. You can sponsor a patient to benefit from the surgical camp by contributing only 480 million Ugandan, 480,000 Ugandan shillings. Thank you.
For West Nile, particularly done in improving health services. My colleague has addressed you on some of the key issues. But specifically on the surgical camp, this morning in our meeting we agreed that as members of parliament we need to lobby. We need to urge government to see that this exercise is being funded by Ministry of Health. In the last 2 or 3 financial years, there have been attempts to put budget specifically for surgical camps to cover the regions of the whole country. What we are going to do, we are going to continue advocating and pushing government to see that Ministry of Health budgets specifically for surgical camps. Whatever will be mobilizing from other people, from partners, will be supplementary, as this is a key responsibility of Ministry of Health. Thank you.
The region in this country, West Nile is grappling from a triple burden of diseases. First are infectious diseases, malaria, acute respiratory tract infections, diarrheal diseases, and so on, including HIV and AIDS and TB, are common in Uganda in West Nile amongst the infectious diseases. Secondly, West Nile is increasingly seeing an increase and upsurge in the cases of non-communicable diseases that include high blood pressure, hypertension, diabetes, cancers, mental health conditions, road traffic accidents, amongst others. That requires us to also prepare the regional health system to be able to address the increasing cases of non-infectious diseases. Lastly, being a border district or region, we have had a number of cases of outbreaks, epidemics. Very recently, in Adjumani district, we had the cholera. West Nile was not exempted from corona, COVID-19, as well as Ebola. Thank you.
Well, for starters, there has been significant improvement in access to surgical services over the years. Unlike the chairperson has mentioned, we are the only sub-region with 2 regional referral hospitals. There has been significant improvement in the health center force with theaters. When I was chairman health committee, there were a number of upgrades of health center 3s to health center 4s. One of them in point is Bondo Health Center 3, which is now a health center 4. What does that mean when we have a health center 4? That means mothers in labor who need obstetric care, emergency obstetric care like cesarean sections, can access them right away, meaning the outcome of their pregnancies is much better. We are trying as government to reduce maternal mortality. And I would like to tell listeners and fellow Ugandans that we were able to drop maternal mortality from 333 mothers to 189, and that is one of the most competitive in the region. And it is because of interventions by government making health services accessible to the citizens. Health Center 3s, Health Center 4s, and hospitals. That's why we're able to achieve a number of these targets. Finally, CT scan services, which are a very important diagnostic service. We did not have them before 2022. I can now comfortably say that in the whole northern Uganda, we now have CT scans in Moroto, in Lira, in Gulu, and in West Nile. Before, from Buganda upwards to northern Uganda, there were no CT scans. There was only one in a hospital called Aber Hospital in Oyam district. But now I am proud to say, as a member of parliament, that we have, and of course, when you have a CT scan, the surgeons are able to do their work. They would know where their clots, they would know where if there's intracranial bleeding and so many other issues, border accidents, all these, as long as you have head injuries, you need to have a CT scan. In Arua Regional Referral Hospital, we now have a new blood bank. It was commissioned early this year by the Right Honorable Prime Minister. That's another milestone for the people of West Nile. So it's work in progress, and we're getting there. I'd like to assure the people of Uganda and West Nile in particular that Rome was not built in one day, but as a member of parliament, as a medical doctor, I can clearly see that there are improvement in a number of these indicators. Thank you.
Yes, the access to surgical camp. In West Nile, we have about 15 surgeons currently, covering general surgery, orthopedics, urology, and ENT. But remember, this surgical camp is coming with about 12 disciplines, okay? Which means they'll be able to do more than what the resident surgeons have been doing. We're going to have a neurologist. This is to do with the spine, the brain, they will be handled. We're going to have endocrinologists, thyroids. We're going to have things to do with the ENT and many other areas which will be covered. That's why this is particularly important exercise for people of West Nile. It will address some of the areas for which they will need to travel to Gulu or Kampala to access the services, and it's going to cut costs for them. You know, this is basically cost-free, and it's going to save the ministry a lot of money, the government a lot of money. When we had a meeting this morning, the president of Social Surgeons told us the cost of this exercise is about 6 billion. And this is what they are going to cover with only 1.5 billion. So it will save the government a lot of money. Thank you.